Well, hi there, Amanda.
Well, hi there, Nikki.
We're back again, coming to you not live from
Yeah,
our
live from our recliners,
recliners.
our respective recliners.
uh,
Because Nikki, if you don't know, Nikki joined the recliner gang. So,
hell yeah. It's the best gang to be in. I don't know why I waited so long to get one of these.
it
It's the
ruins
best
your
thing ever.
aesthetic.
It did ruin my aesthetic. You're right. It sure did. I had to become unattached from my aesthetic to be able to understand the uh the
She had to
wonders.
she had to embrace her inner old man.
Not already. We're not doing this already in the fucking intro with the
It is
damn
it is 2:30 in the
yawning.
afternoon, ma'am.
I know. It's my go to sleep time. I am old woman. So, it's my nap time, bitch. Anyway, hi, we're a podcast. And my name's Nikki and that's Amanda. Say hi, Amanda.
Hi, Amanda.
And we're just two neurodivergent best friends traveling the neuroverse together because we are living in a neurotypical world and we are not neurotypical girls. Amanda, we actually have a topic this week.
I
What are
know,
we talking about?
and it's a topic that we actually brought up last time. And normally, when we bring up a topic that we're going to talk about, we just completely forget about it and don't do it. So,
Right.
that's the ADHD. But yeah, OCD. That's what we're talking about.
Yeah. It's something I've wanted to kind of look into for a while anyway. Um Mostly because I suspect it might be in my house uh in some form or fashion and maybe more than one member of the house. I for anonymity's sake I won't mention what or who. Um but I do think this is going to be a topic that, much like every other learn along with us, is it is a very surface level scratch because there are entire YouTube channels dedicated to OCD. There are entire podcasts dedicated to OCD. It's like it's a very nuanced and complex um
Yeah, our information
thing.
and our take is a grain of sand on the beach of
Yeah,
OCD.
for
Okay,
real.
so like she showed me a video of there's a channel called OCD and Anxiety, and I think it said like 180,000 subscribers. So they
Right.
yeah, there's some channels, and I want to preface this: I do not believe I have OCD. I've never even like ta- like I can't think of the word. I never even brush the idea of having it. So
Yeah.
this is more of a learning about it because everyone knows like the whole and even the video I watched from that channel was about OCD. Like it's like oh people think like OCD is just I just want things to be clean and straight and like I can't have a crooked picture or I'll have to go fix it. So people are always like, "Oh, I like all my books to be in alphabetical order. That's my OCD." It's like, no. It's kind of like saying when someone has like a mood swing, they call themselves bipolar. It's like, no, that's not what that means.
Yeah. Yeah, for real. I think it's one of those, like you said, it's done dirty quite a bit, and it's thrown around and it's used very flippantly. And the more that I have read and watched videos, the people who actually suffer from this do actually suffer from this. Like, it is not fun. It's not a cute little, I just like to have my house clean kind of thing. Like, this is intrusive thoughts, often things that these people would never act on, but are awful thoughts that come into their brain, things they don't want to think about, things they don't want to have to push away, and it does take away from their quality of life.
And it's the whole
So,
it's the whole idea of the dose makes the poison, right? Where
right.
like because someone would be like, well, I have intrusive thoughts. Do I have OCD? It's like maybe. I
Yeah.
mean, that's something for you to figure out. We're not doctors or therapists or anything, and
Right.
so it's more of the OCD is like intrusive thoughts. Like they just keep coming. You cannot like it's different. Like I have intrusive thoughts. Like if I'm driving down the road, and I would think, what would happen if I just let go of the wheel? That sort of intrusive.
Yeah.
But it goes away like relatively quickly, and it's not like I get obsessed over it the entire drive or anything like that. So it's completely different. It's kind of like the whole well, it seems like everyone has ADHD or everyone has autism these days because everyone does all these things. And it's like, yeah, but it's not to the severity or the consistency of it. That's
Right.
with any mental or emotional personality disorder, whatever you want to call it. That's that, like I said, the dose makes the poison. It's how often, how severe, how, like that sort of thing.
Right. Which we will get into in this episode. But before we do, a word from us, because we have no sponsors. Amanda, it's been a minute since we've had a chat.
Mm-hmm.
What's going on with you? Anything you want to get out of the way?
Literally
Off
nothing.
your chest?
Nope. Literally, like
No.
still jobless. Still trying to fight with unemployment. I have to call them again.
Good Lord.
With another letter I received. So it's basically, and I talked about this last time. To the people that say like, oh, it must be so easy to get unemployment. Like I should just lose my job and get unemployment, get paid to do nothing. It's not that easy. It's literally not, because I've been having to fight with unemployment for the past 6 weeks at this point.
Yeah.
Just and I haven't gotten paid a single week. I'm entitled to up to like, I want to say like $12,000 on unemployment payment. And granted, obviously that's not all at once. It's like a weekly check type of thing. So, but I'm entitled to up to 12,000 based on like what my employer paid into it, right? So I have not seen a single dime, and I said this last time or the time before. I don't know. Sometimes when we record the two parts, I don't remember what I say in which episode. But I was telling Granger, our friend Granger, on Sunday, and it said, yeah, I have some friends like that are concerned, like, are you finding work, like do you need like help finding a job? It's like, eventually, yeah, but it's not.
Yeah.
I am also at a point right now, and it's might just be part of my depression. Like I just don't feel like doing anything, and I understand that it's the whole like, it's like, it's kind of like the whole, I would feel better if I just went outside and went on a walk, like the whole dopamine of it. Like I would feel better if I had a job because it would give me the routine that I obviously don't have anymore,
Right.
and was ripped away from me, right? And so, would I feel better? Probably, but right now it's like I just don't. I'm not in the mental state to worry about it right now, and I am good enough financially not to worry about it for a long while, because I am very blessed, like um, to have the means of what I have. Like I understand, like I am more privileged because I know the people that lost their jobs and like they immediately have to find a job like the next day, right?
Yeah.
Otherwise, because they're living like paycheck to paycheck. I've never even like, and I've been at that point when I was in my early 20s and I had a roommate. Um, like I was lucky if I had more than $500 in the bank, right? And I know like
Right.
even to some people, like, you have $500 in the bank. I have like $10 to my name. I
Yeah.
understand. So I remember going through my bank statements and seeing like at one point there was like, I was lucky to have $100 in my bank. So I was at
Mm-hmm.
one point living paycheck to paycheck. So I get it. It's just right now I'm 35 fucking years old. Like it's one of those things. It's like I don't want. It's not something I want to like. I could just go out and get a retail job right
Right.
now if I wanted to. Right? Do I want to? No. Am
Yeah.
I desperate enough to? No.
Right.
No, because I do not have the personality and the patience anymore
Yeah.
to work in retail. And I know we talked about this
Yeah.
at length the last two episodes, so I'm not going to try to harp on it too much. It's so right now I've just been kind of vibing, uh as the kids say, or maybe they don't say anymore. Maybe they're way too past
Who
those
knows what the
terms.
fuck they say?
I don't know what they say. I'm too old for this shit. I'm too old to be on TikTok. I'm not on TikTok. But if I had a TikTok, I'd be too old. Um,
Yeah.
but uh, it's just one of those things where I'm just going day to day, and it is, like I said, partly in depression because it's like I'm not really accomplishing much in my day to day. Like I keep having this like, nighttime Amanda is a lot more active and productive than daytime Amanda, because nighttime Amanda is like, oh, like if you ever catch me cleaning my house, it's at 3 a.m. That is when Amanda is at her peak, between 11 p.m. and like 4 a.m. That is when Amanda thrives. Okay, and So I really just need to get my house in order. And I was telling Granger, it's like I I'm in the state of depression right now where it's like I can't and it's also part of like the executive function aspect, right? I can't get myself to do anything. Like I'm keeping the basic stuff down, like laundry and dishes are being done because obviously I need those things. Well, laundry not so much. I can just wear pajamas all day, whatever. But dishes are being done. I am like vacuuming the floors and stuff, but it's to the point where like I have so many doom piles and doom boxes everywhere that just need to be gone through that I just haven't had the mental or emotional energy to do. So
Right.
that's where I'm at. How
Yeah.
about you, ma'am?
You're in the avoidant stage right now where you're
Yes.
like yeah, you're actively avoiding things right now.
Yes.
Which
Mhm.
is I mean, I get it. We could make a whole episode about this, but like I think there's a lot to say for you not just having depression, but I do think you are in a deep state of burnout just from
Mhm.
being constantly overstimulated at that new building.
Mhm.
Um, and that's a real motherfucker to have to overcome.
Mhm.
So
Right.
I feel like I'm just now starting to get back to a version of myself that is much more enjoyable than I was, and it's taken me a fucking year to get there.
Mhm.
And I'm still not even all the way out of the burnout, I don't think.
Right.
Um, so I think you're doing just fine. I think you should give yourself a little bit of grace right now.
Mhm.
As long as you're physically clean for the most part,
Yeah.
you have food to eat and dishes to eat them off of, and there's no rodents or feces or anything else strewn
Or
about your
bugs or
home, I
anything.
think you're
Yep.
fine. Bugs,
Mhm.
I think you're fine. Like
Yeah.
we're gonna set the bar real fucking low right now, and that's gonna be fine.
Mhm.
Um, but yeah, not much going on with me. I had another neurology appointment, and it's basically same old, same old. I'm still on the lowered dose of the meds that they put me on like 4 months ago. I'm not quite ready to take me off of them yet. I have gained a few more pounds. I'm not super happy about that. But that is my own fault because chocolate has made its way into my house. So that's my own fucking fault. But we're gonna try to. I'm gonna start slowly adjusting my meal choices. I
Mhm.
think I'm in a good spot now where I feel like I have a good routine with my workout to where I feel safe enough to be able to like start slowly adjusting my meal things. I think I said a couple of weeks ago that I was like not quite ready to do it, but for me, things happen rather quickly. Like I'll be not ready for it one day, and then 2 days later, I could be like, "All right, let's go, let's do this."
Mhm.
So I'm, I think I'm starting to get there. The key for me, I think, has been very slow, very consistent. Because if I do things the way I used to do them, which is everything everywhere all at once,
Like balls to the wall, like
yeah, balls to the wall, change it
start from
all
jump.
right now. Yeah, then 5 days a week working out and never eating another carb, and like I cannot do things on the extreme end of the scale anymore. It's going to take me a hell of a lot longer to get things done and get results, but I'd much rather be able to have consistency and it take longer to get the result that we're looking for than slam everything I have into it and then quit in 3 weeks because I can't function anymore like this, like I
Mhm.
usually do. So that's the consistency is key right now. Speed is not key right now.
Yeah. Yeah.
As Jacksepticeye would say, speed is key. It's
Mhm.
not key. This is not Happy Wheels bottle run. Okay,
Yeah.
this is lifestyle changes. So, and then I just dropped a disgusting amount of money at Sam's Club,
Mhm.
which is, if you're not from the States listening, Sam's Club is like a big box store where you can buy things like in bulk quantities and larger sizes of
Like
things than you could like somewhere else at the grocery store.
yeah, you might have like heard of
Um,
Costco. It's like similar to
Costco,
Costco.
yeah, yeah, stuff like that. Um, and I spent a disgusting amount of money. Like, I'm embarrassed to tell you how much money I spent. Um, but the goal of spending the money was
To save
to
money in the
get,
long run.
yeah, to save money in the long run by stocking up on essential household items. Like, for instance, the all free and clear laundry detergent that we use, they sell a giant 120 count pod pack there. It was on sale for $5 off the tub. So I bought two. That will last me a really long time, you know?
It's
And
go on.
go ahead. No, go
I was
ahead.
gonna say it's like when I bought toilet paper. It was like if you buy two, you save $10. And it was like
Yeah.
two, like each one was like a 30 mega pack of like the
Yeah.
mega sized toilet paper. So it's like I have toilet paper that lasts me like probably 2 years at this point because I have like 60 rolls of toilet paper, but they were like you like $5 off each because they were
Yeah.
$10 off if you bought two of them. So it's like I had to find a tote, like a plastic bin to put them all in and put them somewhere else because they didn't all fit in my little closet that I keep like that sort of stuff in.
Yeah, that's what we're going to have to end up doing um with some of this. We bought two of the giant packs. You've seen the packs of
Mm-hmm.
toilet paper and paper towels from there. We bought two of the giant packs each of toilet paper and paper towels, two of the Sam's Club brand that's like Cascade for your dishwasher, you know,
Yeah.
two big things of those because that was on sale. We like the Downy Light scent beads because I buy free and clear laundry detergent because there's certain ingredients in the stuff that has like the regular stuff that makes me break out, but fragrance really isn't the issue. So we put a little bit of those scent beads in just so our laundry smells like something and not absolutely nothing. Um, so I bought two big motherfucking things of
So
those.
they just had like a big sale on a bunch of cleaning supplies.
They did. They had a decent sale. And then the kids' vitamins that we buy there were on sale, like $4 off per thing. So I bought a thing of each of those. Like just a bunch of stuff, right?
Mm-hmm.
And then they had these really nice 27-gallon snap lid totes because a lot of ours are breaking, or the lids don't fit, or we've lost the lids. And Jordan wants to start consolidating some of the stuff he got from his dad's house after he passed away and some of his other things that are like shoved under the bed in totes that they don't belong in, put them in these nicer bins that stack neatly, you know, so that we can have a better system in the garage. So we bought like four of those totes to help him organize some of his stuff, and then we're going to use probably one of them to put our condensed Christmas decor in because it was originally one of those great big long blue tubs, like
Yeah.
the 40-gallon ones, but it's too big now. I condensed a bunch of my Christmas shit down. So we're just trying to get our life together.
Mm-hmm.
Um
Same.
and I feel like we got a little bit of extra money. Um I had loaned out some money to someone to help them with a car repair a while ago. And I give money expecting not to get it back, so I don't give it unless I can afford to not get it back. This was while I think I might have still been working at the time when I did this.
So it's been a while.
It's been a while. But fine. You know, like I said, I don't expect to get it back. It's not a big deal. So that person decided they wanted to go ahead and pay me back. So I got that chunk of money back and I was like, let's just go set ourselves up, you know.
And honestly, it helps so much because, like, remember, it was back towards the end of me working where I just remember I kept having that, like, feeling, I'm like, I don't know, I have this feeling like I'm not going to turn into, like, a prepper or anything, but I just have
Yeah.
this feeling that I need to, like, stock up on stuff. And I don't know why.
Yeah.
Well, there you go. Like,
There you
because
go.
like, so it's like I was like I just had this feeling like, and I joked just like I just feel I'm gonna get fired. Like my feeling of needing to prep for things had nothing to do with like my job. It was more of the
Yeah.
fact of like I wanted to create like an emergency kit like that I would keep in my car, like stuff like an extra pair of clothes, like a blanket, you know. And I have like some
Yeah.
emergency stuff in my car. Like I have a thing of water bottles. I know you're not supposed to drink water bottles from your car, but whatever. And then so like I do have some emergency like actual emergency stuff like you know like a flare, a emergency blanket, that sort of stuff. But I want to keep like say the apocalypse happened tomorrow, like, and
Right.
I have like I have like a duffel bag of like just a thing of toiletries, like a thing like I said, extra pair of clothes, stuff like that. And so I had this just leading like the past like several months, I was like, I don't know, I feel like I just have to have extra stuff. I don't know what it is. Like, I'm not becoming a hoarder, I'm not becoming a stalker. Like, you, if you looked at my
Yeah.
house, you wouldn't think that I was. It's just
Yeah. Yeah.
like, oh, I have a half of roll of like a half a huge roll of trash bags, might as well buy
Yeah.
another thing of trash bags. Oh, I have like four things of toilet or paper towels left, might as well buy a 6-pack of paper towels. So
Right.
I'm glad to now, like, I don't have to buy stuff like that for a good long time. And so it really just kind of worked out that. So I
Yeah.
feel like it's going to work out for you guys too.
Yeah. And then we decided we were going to buy, because meat is actually much cheaper there. I was doing some price comparison. So we got like
I heard
15
Sam's
pounds of
is.
ground beef.
Yeah, I heard Sam's is. And
Yeah.
your mom is the queen of buying a stuff in bulk and then freezing it until the end of time. So
Yeah.
I think you could just cook all
So,
at once and freeze.
yeah. So we froze it raw for now. Um, but it's like already pre-portioned out basically in like 1 pound cubes, so I wasn't really too worried about it. Um, but we have like 15 pounds of ground beef in our freezer right now. So I'm probably just gonna maybe every paycheck, every second half of the month paycheck is a little bit bigger. We have a little bit more nest egg on that than we would our first half of the month just because of the kind of bills that come out. I think I'm gonna start like even if I'm not out of something, I might buy like one or two of that thing and then
Mm-hmm.
slowly just build up more of a stock because it just seems to make sense right now. I don't know why all of a sudden I want to do this because before I was like, get it all out of my house. But I don't want to become a hoarder. I don't want to have too many things. And I'm trying to be conscious of things that like that's expire at some point or freezer burn before I'll ever use it, right?
Right.
But I just feel like right now it just feels better to have stuff
Yeah,
and
it's
not need
until
it.
like, because have you ever watched the show? And I know we promise we're gonna get to the topic.
Yeah, we
We're not.
promise.
And you ever watch the show? I used to watch this show all the time. It was extreme couponing, something like that.
Yes, yes,
I
yes. I
like
won't go that bad.
I won't either because I'm not like couponer. I like some people. I remember even watching, like, this was probably, I want to say the early 2010s is when I watched it the most, and I feel like it was
Yeah,
on because I had cable at the time. So yeah, I remember watching on TLC, and I like not admired them, but I'm like, like the fact that they like, I really only admired the ones that were like, oh, I do this so I can donate it. Okay,
right.
that's fair because I've done that too. Where when I worked at Barnes and Noble, we had stuff on clearance, stuff that like went down to the $2 list. I bought like thousands of dollars worth of stuff for like $150 and donated it
Nice.
all to the women's shelter. So like for Christmas. And so like I've done that stuff. But the like until you get to the point where you have an entire room like
Yeah,
full of stuff, I feel like you're fine because like
yeah,
until you get full on shelving units in like your garage and that's where you put all your stock, I think you're fine. So I wouldn't worry.
yeah.
I wouldn't worry too much about
I
it.
mean,
Like
I
if
kind of do want a shelving unit to put things on,
yeah,
but
but
not
like
like every wall of
I'm
my
not talking about
garage.
a lot. I'm talking about a
Yeah.
wall full of shelving unit. Like yeah, because I could like do that in my back bedroom, like have like
Yeah.
a shelving unit just of like stuff like that, but I won't. So
Yeah.
like and there's some people on that show, they were like, I coupon like 30, 40 hours a week. I'm like, you could have a job with that amount of
Right.
time.
Yeah,
But
that's a lot.
mhm.
Um okay,
Maybe
we
that's
should
their
probably get
OCD.
to the
There we go. Maybe that's their OCD.
Yeah,
I don't
maybe
know.
all of this is OCD. We don't know.
Mhm.
We're not
Yeah.
doctors. Um but yeah,
It's been
let's
25
get
minutes. Maybe we
to
should get
it.
to the point,
Yeah.
you know?
Yeah, we probably should. All right. So, let's get to the point here. Um the first website that I would like to pull up is the International OCD Foundation.
I read that as like the acronym is I don't give a fuck. That's not at all. Like I just had like my brain just read it so weird. It's iocdf.org.
Yeah,
IOCDF, yeah. iocdf.org.
and we will of course link all of this in the show notes. I've already been building out the uh thing so that I'm not forgetting to do it. So I'm sorry if you can hear my husband. He's on a work call. Um, let's see. I gotta back it up here a little bit. Sorry.
Back that bitch up, back it up, back it up.
Okay, here we go. All right. In an effort, again, to not read to
Read at
you
you.
because
Mm-hmm.
you all can read. Um, the we'll get to like the basic definition of what it is, and then I'd like to go to or what it's clinically like the clinical definition of it, and then we can get into some of the other like more nuanced things because obviously research is better when you do it yourself and read it for yourself. But and I want to definitely want to talk about how this is diagnosed as well because I feel like that's really important or how like who to go to. What
Mm-hmm.
kind of person do you need to go talk to
Because we
get
can we
this
can talk about the
diagnosed?
signs and symptoms all day, but until you
Right.
actually talk to someone professional.
Right. And I feel like I know we mention it sometimes, but I feel like I really want to start making that more of a thing that we make sure we emphasize. Like, yes, we say like go talk to someone if you need help, but like we need to start saying like go talk to this specific kind of someone if it
Yeah.
does, say
Like
it. Cause
sometimes
and I did
a general doctor is not gonna know, or
right.
even a
Right.
general therapist is not gonna know.
Correct. So, real quick, do you want to read what is OCD to the people?
Sure. So it says there's a public misconception that obsessive compulsive disorder, OCD, is just a minor personality quirk or preference and that everyone is a little bit OCD. In reality, OCD is a serious and often debilitating mental health disorder that affects people of all ages and walks of life and occurs when a person gets caught in a cycle of obsessions and compulsions. Obsessions are unwanted, intrusive thoughts, images, or urges that trigger intensely distressing feelings. Compulsions are behaviors an individual engages in to attempt to get rid of the obsessions and or decrease distress. Most people have obsessive thoughts and or compulsive behaviors at some point in their lives, but that does not mean that we all have some OCD. In order for a diagnosis of OCD to be made, the cycle of obsessions and compulsions must be so extreme that it consumes a lot of time, more than an hour every day, causes intense distress, or gets in the way of important activities that a person values.
Right. So I'm very happy that I chose this as opposed to like the Mayo Clinic because while yes, this is a clinical diagnosis, right? I'm oh shit, pardon my go get your kid alarm. We're leaving it in. Fuck it. We'll do it live. Um, I thought I turned it off when I got up to go get my husband, but I guess I didn't. Anyway, I wanted to choose something like this resource to reference because this is just it made the point of saying like the unsaid thing, which is like this isn't cute, this isn't
Mm-hmm.
quirky, this isn't I just like to have a super clean house and how nice must it be to have to clean to love to clean that much, right? People don't love this. This is
It's
not something that people find enjoyable.
it's kind of like when like thinner people, which I understand that they might have like actual body issues, but like sometimes like when thinner people are like, I don't know, I just can't gain weight. I just eat all the time and I can't gain weight. And I understand like some people have a genuine issue of that, and so I'm not making fun of those people. I'm talking about like
Right.
you know the type, like the cheerleader types, like the little Miss
Yeah.
Popular blonde girl. They're like, isn't it like I like how they kind of like say it as like a humble brag? Like I don't know, I could just eat like an entire pizza and not gain a single ounce. It's like, oh, poor Becky, it must be so hard being you. Like this isn't like a little quirky thing.
Right. Yeah. And this is very distinct in how it's diagnosed. I feel like one of the more distinct ones that we have come across lately, although as we'll talk about here in a little while, in its contrast to autism, which this can also be a comorbid condition with autism, which, I just want to mention that you can experience both. Um, but it does have some more sharp contrast than some of the other comorbidities that we see that go along with autism. Um, this is all about your obsessions triggering, like something triggers an obsession or a rumination or a thought. And in order to remove that, in order to get away from that thought or experience, you have to do a ritual, which would be the compulsion, to make it go away. The most common example used is like you are afraid of things being contaminated, or like an ultra germaphobe, right? Someone who might consider you an ultra germaphobe. But the difference between someone just being a germaphobe and someone having OCD and it being related to things being contaminated is that they have to wash their hands so often, that or clean something so often, that sometimes people's hands will be chapped
Yeah,
and bleeding.
I worked with someone. I won't say where, like who, obviously, but I worked with someone that was like this, and he got to the point where no lotion could like help his hands. Like they got
Yeah.
so cracked and dry because, and we worked like with the public, and he anytime like someone would like shake his hand, he obviously you could see it, like he would be like cringing on the inside, and
Yeah.
like if you knew him, you could tell that he was not enjoying this. And so he wasn't like a germaphobe per se. It's just the whole like washing his hands was the compulsion. Like he was constantly in our break room washing his hands, and like remember one time someone like shook his hand like thanking him for something, and then after the person left he was like, I don't understand. He like immediately like rushed to the bathroom. He's like, and said, I don't understand why people like insist on shaking my hand. And so, and he just, his hands were always red and cracked, and he kept lotion on him at all times. He said that even like medicated lotion doesn't always help. So it's sort of that thing. It's usually like a set number. Like I know people that they have to turn, like when they're leaving, they have to turn their lights on, like, or turn their lights off and then back on and back
Mm-hmm.
off, or lock their door, unlock the door, like at least 3 times. Like, and it's usually a
Yeah.
certain number. Like they have to do it like 7 times, and that's what gets their compulsion like away.
Right. Like if I know that if I stand here and do this at least 3 times, my brain will stop telling me that the door is not locked. Right. Like that's what it is. You're trying to do the behavior to get the thought process to stop, to get the obsession to stop, the rumination to stop. So very quickly, I'll just briefly define and touch on obsessions and compulsions, and then we can talk about the different types. I will not go into nuance on the different types. That is something you guys can research on your own. Again, this will be linked and they're very in depth. So this is a really good thing to check or click on if you want to learn more. So obsessions are thoughts, images, or impulses that occur over and over again and feel outside of the person's control. Individuals with OCD do not want to have these thoughts and find them disturbing. Obsessions are typically accompanied by an intense and uncomfortable feeling such as fear, disgust, uncertainty, and or doubt, or a feeling that things have to be done in a way that is just right. In the context of OCD, obsessions are time consuming and get in the way of important activities the person values. So, having things be just right is something that we can experience in autism because we like our things. Some of us like our things a certain way. We have things that have to be done a certain way, and it needs to be done that way. The difference is, no matter what, you could be getting ready to leave the house and you're already running late. If you didn't do something just right or someone else didn't do something just right, these sometimes people will risk being late or missing the thing because they can't not fix it, right? Like
Mm-hmm.
it has to be fixed.
Or they obsess
It's
about it the entire time.
right. It has
You
to
can be
be
trying to
done.
drag them out of the house, and they'll be like, "No, I
Right.
gotta do it."
Right. And it's not it and it's causing them such obvious distress and discomfort, right? As to where someone who's autistic might get upset, right? That their things are not in place and they might, quickly get that done. They might seem the same, right? It might seem the same. It's a little different. These people they cannot move forward until that thing is done. It's not it's not possible for their brain to make them stop thinking about it until it is how it should be, right? Another thing I want to bring up, well, actually, we'll wait. I'll bring that up in a minute. So some common obsessions can be around, like I said, contamination, having like acts of violence. Not saying people are violent, but it's the fear of acting on an impulse to hurt yourself, or the fear of acting on an impulse to hurt someone else, or excessive thoughts about violent or horrific things. Okay, it's not someone who is violent. Doesn't mean OCD makes you violent. I want to make that very clear. Responsibility obsessions. You don't want to be responsible for something terrible happening to somebody, for example. Perfectionism related obsessions. Sexual obsessions, religious or moral obsessions, or it's also called scrupulosity, which is a fun word to say. I like how that feels in your mouth when you say it. Identity obsession. So this they find comes along with both gender identity and sexual orientation. You think about this so much, which I thought was fascinating. You think about it so much, or you constantly are questioning your gender identity or your sexual orientation. The one example that I saw in a video was like, well, I think about women so often and I'm a woman, so I must be a lesbian, right? Even if in your mind, like logically, you would never have a sexual or intimate relationship with a woman, being a woman, you think about it so often that you think, well, maybe I am, right?
Mm-hmm.
So that's an option. That's like a very vague example. Okay, very vague example. Um, and then other things like relationship obsessions, obsessions about death and existence, a real event versus false memory. So that's more of a concern about things that happened in the past and what impacts they might have had. Um, or like thinking about, did that really happen to me, or did I just imagine that happened to me? And that constantly searching through your past to figure out, find an answer of, was this real? Did this really happen to me? Asking people around you, did this actually happen, or did I dream this, right?
Right.
And then emotional, this is emotional contamination obsessions, like catching personality traits or personal characteristics of other individuals. And then, do you want to read compulsions or do you want me to?
I can read compulsions.
Okay.
So it says compulsions are repetitive behaviors or thoughts that a person uses to neutralize or counteract the obsession, essentially to try and make their obsessions go away. Sorry, I just immediately thought like pray the gay away. I just really thought that.
That's a thing.
Yeah, I know.
It's part of it. Yeah.
People with OCD realize this is only a temporary solution, but without a better way to cope, they rely on compulsions nonetheless. Compulsions can also include avoiding situations that trigger obsessions. They are time consuming and get in the way of important activities the person values. Do you want me to read compulsions versus rituals, or just go back to go to common compulsions?
Maybe just that highlighted portion.
Okay. So like compulsions versus rituals, it says most cases, individuals with OCD feel driven to engage in compulsive behavior and would rather not have to do these time-consuming and often torturous acts. It said rather than being a source of pleasure, people with OCD perform compulsions because they believe they're necessary to prevent negative consequences and/or to escape or reduce anxiety or the presence of obsessions. So basically, they feel like they have no choice. Like they don't want.
Yeah.
It's not something they enjoy doing. It's not something that's fun for them to do.
Yeah.
So like common compulsions in OCD are like washing and cleaning, like I said, like washing your hands, or you're like cleaning your kitchen counter or something like that. Checking that you did not or will not harm others, you or will not harm yourself, that nothing terrible happened, that you did not make a mistake, or your physical condition or body. There's repetition involved, like routine activities, like going in and out of doors, getting up or down from chairs. Like I said, the whole flipping your light switch on and off to make sure it's actually off. Or I know people that will go back and check their ovens or curling irons like multiple times to make sure that they're off. mental compulsions, like reviewing, like doing a mental review of events to prevent harm, either to yourself or others, to prevent consequences, and praying to prevent harm to yourself or others. And then other compulsions are like putting things in order or arranging things until it feels right. Telling, asking, or confessing to get reassurance. Like basically like to me that make like, are you sure you're not mad at me? Like even if the person reassures them multiple times, I am not mad at
Yeah.
you. like or are you sure I didn't say the wrong thing like multiple times? And that's also
Yeah.
like a part of anxiety, but I feel like people with
Yes.
anxiety it's basically anxiety to level 10. Um
Yeah.
and then avoiding situations that might trigger your obsessions. So those are some I kind of did a very broad, like obviously if you look at the link, there's more specific
Yeah.
terms, but that's like the broad like common compulsions.
Yeah. Let's go into um how this is diagnosed. So this was very important to me because I want to make sure people understand who to turn to, because with the myriad of things that we talk about on the show, different professionals are required to diagnose different things, right?
Because they have
This in
specialities, they have
particular,
they have specialities, or they're like so the whole like experts in their field type of thing.
correct. So for this in particular, it's a little bit broader, but it's also um like for autism, it's a little bit shorter of a, or more narrow of a range of people who can diagnose it. This is a little broader because this actually includes licensed um, clinical social workers, or otherwise known as therapists. But make sure, okay, please make sure that they are licensed, at least a licensed clinical social worker or higher. So, or a psychologist, or farther along than that. Okay, you need to make sure that they are at least a licensed clinical social worker. They are qualified to diagnose this particular condition. Um, and there's different characteristics they're going to look for. I again will let you guys read that, but it is important that you know who are you talking to, because not every therapist, not every counselor has the same credentials or letters after their name. You want to look for LCSW after their name. That is the one that is licensed to diagnose certain, not all, certain conditions like these, but especially this one. So if that is something that's available to you in your area, and at least in the States, I don't know what the qualifications look like elsewhere in the world, but at least in the States, that is what you need to look for, the credentials behind their name. Um, Also, a psychiatrist or a psychologist can diagnose this as well. You will most likely be seen by a psychiatrist, because the psychologist and the clinical social worker cannot give you medications for this. And if they feel that medications will be helpful for you, they will most likely refer you to a psychiatrist for this. I don't know that many general practitioners take this on because it can be so nuanced. At least um in the how do I find help for OCD, when I just searched like the battery of folks that were here for you to look through, most I did not see any GPs, general practitioners, or PCPs, primary care providers. Very, very, very few. So it seems like this is going to be something that would be referred out. So it's also something to think about. This does have, like I said, a database available to you to find someone in your area. There are also call your insurance company if you have medical insurance. I understand not everybody does, but if you have medical insurance, call your insurance company. They can help you find a provider. Or if they have an online website that will show you in network providers, use that. Use those tools to your advantage to get the help that you need. This is not something you should go untreated for. That is basically what I have seen in most of the research. It can get better for you with proven to work therapies and sometimes medications. And the medications that are used to treat this are often SSRIs.
Mm-hmm.
Um, so they're often used to also treat other things like depression and things and anxiety, things like that. But you would most likely be prescribed some form of SSRI if you are prescribed a medication for this. And I say if because I don't think everyone would benefit from a medication depending on what it is and how severe your OCD is. So I just wanted, oh shit, I threw my headphones. I just wanted to make that point very clear. What were you going to say, Amanda?
Well, I wasn't saying anything.
I thought I heard you try to jump in and say something. Apart from the usage of medication, it also says that some of the most effective treatments for this are cognitive behavioral therapy or CBT, and then a type of CBT called exposure and response prevention. This has the strongest evidence in supporting in support, sorry, for symptom relief of this. So I think it's also important. A lot of things that I saw to manage your expectations, much like everything else with your mental health. This stuff takes a while. Um, and it does say that, you know, depending on the severity, you could go from traditional outpatient treatment to all the way up to inpatient care.
Mm-hmm.
But that's, again, more of an intensive thing, would be more of a escalated reason for you to need that. But again, that would be something for you and your providers to discuss. Um, Anything else you want to add before we jump into the autism versus OCD infographic that we love so much from our Neurodivergent Insights website from Dr. Anna Neff, Megan Anna Neff? We love her.
Yeah, we love a good infographic. No, I think we pretty much covered. I mean, I definitely learned more about OCD just this from this one article or
Yeah,
info page than I had before. Because I also have, in the past have said like I said, I've never claimed to have OCD or anything, but it's like I said, the whole little quote unquote joke of like, oh, I need that picture to be straight on the wall. That's just my OCD
right.
though, and or like, oh, I noticed that's crooked. I have to fix it, or else otherwise my OCD will get to me. And so I feel like everyone has probably said that joke at some point in their life.
Yeah, for sure. So if you want to pop over, Aminder, to the uh infographic.
Yep. And like we said, this is on neurodivergentinsights.com.
Yep, and we'll be linked. All right, take it away, Aminder.
Okay. So this is about, it says autism versus OCD. I like the title of the graphic. It says Misdiagnosis Monday. Misdiagnosis Monday. OCD versus autism. So, okay. So we're going to talk about first, like, what seems to be more strictly OCD, according to this infographic. So that's the presence of obsessions, like which is persistent, distressing, and unwanted thoughts, images, urges, and sensations that invade the mind. Repetitive compulsions, which are when the person feels driven to perform, functioning to reduce anxiety associated with the sessions. A direct relationship between compulsions and obsessions, for example, hand washing to address fear of contamination, and avoidance behavior, actively avoid situations or objects that trigger obsessions and compulsions. For autism, which, like I said, so seems to be more autism than OCD, is like the autistic communication, which is the literal, direct, and authentic communication, doesn't pick up on allistic social cues subcortically. Repetitive behavior that self-soothes through repetitive behaviors, rituals, routines, and stimming, which is not connected to obsessions. Indirect relationships, repetitive behavior not tied to obsessions or fears, may show up as building collections, stimming, and routines. And the monotropic mind focuses intensely on specific interest, processing information deeply within a single topic at a time. So those OCD and autism can overlap. So here's what they put that can be seen in both. Obviously, not all of them. You can be autistic and not show some of these traits, and you have be OCD and not show some of these traits. But for the overlap, includes anxiety, insomnia, perfectionism, difficulty difficulty tolerating uncertainty, repetitive behaviors, seeks routine and familiarity, sensory processing differences, skin picking and hair pulling, uses withdrawal to cope, obsessive minds, high rates of substance abuse, and repetitive thinking. So, like, all of those basically can describe me, but I wouldn't say I like OCD. Like, nothing really on the OCD side really describes me. So that's why
Yeah,
it's like I'm more like autistic than OCD.
same. And I also was interested. This got me going down another path, which maybe our next topic, kind of, again, another big ask, but maybe we could talk about PTSD and trauma at some point, because I feel like you see some of these things in that as well. And I specifically, when they were talking about like ruminations and things, I'm gonna link a couple videos on YouTube that I found in the show notes as well, and they explain it pretty well. But like, your obsessions and compulsion don't have to be outward; they can be all happening in your mind. So, which is very confusing. But you could have OCD and have no outward indication of it. It could all
Mm-hmm.
be happening in your mind. And so I was curious. And you know how you and I talk about like the 3 a.m. thoughts, right? Where
Yeah.
you replay old conversations you've had in your head over and over again and think about things, and it like takes you back to that time and you can feel the cringe as if it's happening in real time, right?
Yeah. Mm-hmm.
Some of that stuff can be seen in OCD, but I looked it up, and basically, this can also be seen in um, people that have anxiety and also depression, and then also like PTSD can be a part of it.
Basically, we're saying
So,
personality and mental disorders tend to just be one big Venn diagram.
right.
Just a giant ass Venn diagram of like 75 million different things, and there's a little overlap with everything, basically.
Yeah. And then the intrusive thoughts, because again, we've both said we have those. I struggle with intrusive thoughts quite a bit. I don't know that they are to the level of OCD, but I do have intrusive thoughts quite often. And this can be connected to OCD, PTSD, or anxiety or other disorders as well. So it's it's just like you said in the beginning, the dose makes the poison, right? Like, how, to the severity of which is this affecting your life? Like, how badly is this affecting your life? Is it to the point to where you are non-functional, or it's severely interfering with your day-to-day life? Then you might be on the end of the OCD spectrum here. But otherwise, it could be related to one of about five other things. So, like, that's why we will always tell you, please consult a provider, the proper provider. If you don't know where to start and resource searching is difficult for you, or you have a lot of anxiety about looking for things on the internet, Dr. Google tends to become your friend and you get down a rabbit hole. Make an appointment with your general care doctor, your primary care physician. Talk to them. They will refer you to the right person. That's part of their job. And they need to know that that's happening with you anyway, because they're the one who sees you generally, right? So any specialists that you're involved with, also communicate with them. Get a better understanding by starting with your primary care if you can't, don't want to, or find it difficult to seek out a provider near you. Don't just assume, okay? Don't just assume. And that's real rich coming from someone who's self-diagnosed autistic. But I feel like it's a slightly different situation there, because it's incredibly difficult to get a diagnosis of autism as an adult. It's not so difficult to get a diagnosis of autism of OCD as an adult,
I feel
right?
like OCD is
So,
more, if obviously, if like, I feel like OCD is more, I don't want to say obvious, but because like obviously you can look at a person with OCD, like a
yeah.
person with autism, and they just look like, obviously just like people. They don't look any
Yeah.
different than anyone else. But it's more of the fact of like if someone like say someone like autism is like trying to stim, like, you know, play with their hair, that might just be
Yeah.
seen like as they're nervous or something. Whereas
Right.
like person with OCD, if you see someone with OCD, like I said, that person I worked with that would shake someone's hand, like he immediately had to go and wash his hands multiple times.
Right.
So that's to me that's just a more obvious thing. Like obviously
Yeah.
I'm talking about like level 1 autism, whatever the lowest level.
Yeah, level
I
1.
know, yeah, level 1
There's 1,
autism.
2, and 3.
Yeah, so whatever, because it used to be called high functioning autism. So
Yeah. Yeah.
someone that's like high functioning autistic, it's not as obvious as someone with like OCD. At least to me, I know that's painting a broad brush, but
Yeah.
to me, it's not as obvious.
Yeah. Um and that I wanted to include that little last bit too because it's things I was thinking about as I was doing the research. Like, well, I experienced that, right? So I'm like, okay, let's go down rabbit hole, a tiny rabbit hole, and figure out what other conditions might these things show up in. Doesn't necessarily mean that I have OCD. Let's at least look for other things first, right? So I think it's got a very clear set of diagnosis. Like it's very clear criteria for diagnosis, right? And for other, not all, but for some other conditions like autism, things like that, if you are level 1 especially, has a much broader array of shit that you could be having an experience that could be diagnosed as something else, right?
Right.
So anyway, that's just my fucking sidebar on that. Are we Do you have any other thoughts? Anything that you saw that you were like, "Oh, that's interesting. I do that too," kind of thing.
Um, in terms of like OCD, like I said, this is a very vague infographic, so
Yeah.
obviously doesn't cover everything. It's it's interesting like how much overlap there is between OCD and
Yeah.
autism.
It's a lot.
Yeah, because like I said, pretty much all of these things, like I don't have substance abuse.
Right.
Um, like I do the skin picking. I'm even doing it right now. Like the whole skin picking thing. Like yeah, I do the skin picking. Like it just basically almost all of these like the overlap apply to me. So it's just interesting like how much of this because it's this overlap that means people with OCD have this as well for the
Right.
most part. Like obviously some people can like wouldn't have all of these things. Um,
Yeah.
but yeah, like I said, like the whole intrusive thoughts thing, like yeah, I have them all the time, but like it's not something I like obsess over. It's not something
Yeah.
that's like I don't have like a compulsion to get rid of them. It's just
Yeah.
they kind of just appear. I ruminate them on them for like a few minutes and they go away.
Right.
So
And I don't think that's not the case
right,
for people with OCD, that they
right,
don't go away until you do something to quote unquote make them go away, or you try to do something to make them go away, right? And
and
even then they
also
might not go away.
it's interesting that the whole nowadays it's like well you're just self-diagnosed autistic or you're just self-diagnosed ADHD or like you just got that from TikTok. I never really see anything about OCD. And it's
Yeah.
interesting like I don't it's like I'm not sure if it's because it doesn't come up on my algorithm or what because it's on like
Yeah.
I'm sure now it will because I said it out loud, my phone's right there. But so
Yeah.
I'm sure I'll see tons of videos about OCD now. But it's the whole you like because I think it's more see like I feel like both OCD and autism are seen as like probably more along the lines of ADHD. I feel like ADHD and OCD are kind of seen as like quirky things about
Yeah.
somebody. Like, oh, you're a little bit hyper. That's just my ADHD. Like, oh, you're a little bit perfectionist. That's just my OCD. So it's
Mhm.
just I feel like, but I never see anything about OCD. I think that's because it's not as prevalent. Like,
Yeah.
you don't see as many like you don't know of as many people with OCD, like straight up
Like
OCD. Like I'm talking
true OCD.
like
Yeah.
true OCD, not just liking things correct like in a correct way.
Yeah, it
I'm
said
talking about
1
like
to 2% of people are
yeah.
diagnosed with
So
this.
that's probably why I don't see a whole lot of it, but it's just interesting. Like you never really see much about it besides like someone using it as like a little personality trait that they have.
Right. Okay.
That's it. That's it for my thoughts.
Not another yawn. Damn. All right. Well, let's hit the fun and fuckery, shall we?
Sure.
All right. We made it to the other side.
I got friends
Uh,
on the other side.
I'm always looking for these questions. It's your turn. Find one.
Just any
Ah,
question.
right now.
Just any question about life?
Yeah, I don't care. Something we can
Okay.
talk about for a few minutes. Whatever you
Okay.
want.
You didn't. No warning, ma'am. Uh.
This is the most stressful thing she'll ever have to deal with
Yep.
this day.
Yep. I feel, have we ever talked about if you have any superpower, what would it be and why?
Yes.
Okay. What about we talked about place to visit? Talked about that. What is the weirdest food you ever tried?
Ooh, weirdest food I've ever tried. Um, I don't know that it would be considered weird.
Weird to you, I guess.
Um, okay, so I have like essentially two instances, one where I knew what I was eating and one where I was lied to about what I was eating and then found out later what I ate. Um, I at one point during a certain relationship which I will not bring up, and you know what I'm probably talking about,
Mm-hmm.
it resulted in a child. Um, their family was rustic, we'll put it that way. And was breeding rabbits for consumption. I had made the point that I really don't ever want to eat that. And to please let me know if that's what I'm actually eating. Because until the world burns and the bunnies are all that's left to eat, I will not be consuming the bunnies.
Mm-hmm.
Okay? Well, they thought it would be funny to prepare the bunny similarly to chicken and give it to me anyway. And I took a bite of it, and I will just tell you the assault on my mouth that
I
was
heard rabbit's very
bunny.
gamey. I heard it's very gamey and chewy.
Oh, the texture and the taste are nothing like chicken. It was an immediate spit it out. And I said, I'm so sorry. I don't spit food out, but what is this? Because it's not chicken. And they all started laughing around the table and said, remember so and so out in that cage? And I almost threw up at the table. I was so fucking mad. Don't do that to people. That's really shitty. If someone tells you they don't want to eat something, don't trick them into fucking eating it. That's gross. Secondly, I grew up in a home where Slovakian heritage was a big deal. Okay. They like their meats. Okay.
Mm-hmm.
They like their sausages. So,
Have you pudding? You don't eat your meats.
yeah. So, my grandfather loved blood sausage. Okay.
I knew it was gonna be
Loved
blood
it.
sausage because it's the whole Eastern European or like
Yep.
Scandinavian thing. Because like I've had Scandinavian blood sausage before.
Mm hmm.
Disgusting.
Blood sausage. And you know what? I wasn't mad at it.
See,
I really
no.
wasn't.
Mm-mm.
I ate a half of one. He's like, just try it. And I'm a pretty adventurous eater. You know this about me. I'll try pretty much anything. I've eaten the tentacles of calamari before, like the squid. I've eaten that. That shit doesn't bother me. I'm pretty adventurous. There's very few things that I will say no to. Head cheese is one of them. I would not eat the head cheese. Which is basically like brains and shit. Congealed into a block of gummy nastiness, and I will not eat it. He ate that all the time, but I refused to eat that. But I tried the blood sausage, and I was like, you know what? I can look past that there's actual blood in this. There really is actual blood in it. It's fine. It was all right. I don't seek it out anymore, but I ate it once, and I was like, that's okay. And then we used to also make our own form of sausage. It was a potato sausage. So there was like ham and bacon and potatoes and seasonings things. It was called droba. And it's fucking delicious. But I learned at a young age how to make a sausage the real way. is you use sheep intestines, the lining, right,
Mm-hmm.
to make it. Listen, again, that shit was so good I can look past the fact that that was sheep intestine that it was in. Okay,
I was like, well, that's what haggis is, isn't it?
I have no idea. Haggis is sheep's stomach.
Sheep's stomach.
It's sheep's stomach. It's tripe filled with a bunch of shit. Uh, but yeah, this is sheep intestines filled with yumminess. And again, they're very clean. They don't smell great because it's intestines, but it was very clean. There's no fecal matter. It was fine, right? It's fine, but it was delicious. The best crisp you'll ever eat. So good.
Mm-hmm.
Okay, your turn. Now that
So
I've grossed out half of our audience.
I am not an adventurous eater, at all, and that's where my autism comes in. I am not an adventurous eater at all. So I guess like I don't really have that many. Probably what I ate wouldn't really be considered weird. It's just obviously not. And what I ate was fine. It was and good. I'm saying weird as in it's not in my normal food repertoire. Okay,
Yeah,
so
yeah. Weird to
like
you. Weird
yeah,
for you.
weird
Yeah.
to you because either because of location, availability, whatever. So like I had when I was in New Orleans, I had gator sausage, and
Ooh.
gator sausage was good. It
Yeah.
was good. Like I ate it because like I will eat like there's meats that like I'm not like a huge meat eater, but unless it's like gristly and fatty, I hate the
Yeah.
fats of meats. So if you're gonna give me a meat, at least cut the fat off. So if it's
Yeah.
like really the only thing I don't mind the fat of is like bacon, and that's because I have to crisp it up, right? It can't be
Yeah.
like limp. Like if you hold up a piece of bacon and that thing falls over, you better cook it longer, okay? If
That
it
shit
has
better stand
if
up, okay?
if it has limp dick syndrome, I don't want it, okay? Like I don't want it.
Not
So
limp dick syndrome.
I don't want it. But so like I guess so gator sausage in New Orleans. I think when I was in Spain in Pamplona, like I remember being advertised like bull testicles because they do the bullfighting there.
Mm-mm.
So no. E- I feel like even if you didn't tell me something was bull testicles and I would probably still be able to tell like
Oh, you
that's
can
fucking
tell. That's pretty fucking distinctive if you've ever seen someone cook them
yes.
on TV.
Yeah. And so I never obviously never had that, but the other strange thing I had was shark.
Oh,
Was
interesting.
shark, which I'm not a big seafood person, so it was fine. I feel like it because it didn't feel like regular fish. I feel like
Yeah.
it wasn't like my favorite because like I said, most seafood is one of those things. It's like it's both smell and texture for me.
Yeah.
Like whereas like 99% of other foods is just mainly a texture issue.
Yeah.
So which was funny because like I was at Scott's. I don't know if I told the story, but I was at Scott like a few weeks ago. I was at Scott's and he had bought like a jar of pickles. I said, I've never liked pickles. Let me see if I, because like obviously as you grow, your taste can change. And
Mm-hmm.
so I grabbed one of the pickles. It was just like a slices of, I don't know if they were dill or not, but it was like the circle slices, not like the spheres.
Yeah.
So I grabbed a slice, put it in my mouth, and took one bite down. I go instantly no, and so I immediately like throw it in the trash. And I
Was
was
it
like, oh
vinegary or was it
yeah,
sweet?
it was vinegary.
Okay, then those are regular like dill
Yeah, the kind
pickle
you see on
kosher
like
dips. Yeah.
the kind you see like
On
on
a
like
burger.
burgers. Yeah, and so
Yeah.
I'm like instantly no, and it was both taste and texture. So yeah, so I guess
Yeah.
like the weirdest food for me, because like it's something I have to like rack my brain for, because it's like I said, I'm not an adventurous eater. I kind of just stick to like meat and cheese type stuff. I like salad, but I will eat it separately from other things. I guess the other thing was I had grilled octopus
Ooh.
like when I was in Spain because like northern like northwestern part of Spain has a lot of seafood. It's called pulpo, which is I think just means octopus. And it was called pulpo, and it was grilled, and it was pretty good. It was you could tell it was like an octopus like tentacle thing, but
Mm-hmm.
because of it was grilled, it was better. Like if it was like calamari, like I've had calamari, I don't like it because it's very squishy. But
Yeah.
this was grilled, so I guess so mine's all meat. I don't know why all of ours are meat based, but so I guess gator sausage in New Orleans, shark. I don't remember where I was for shark. I think it was like on a cruise or something, and they had shark. But so shark and octopus, and like
Well,
other
they're
people
just
are like,
catching them off the fucking back end of the boat or
yeah,
something.
I don't know, I don't remember, but it's just one of those things where, and I'm sure like this is weird to us because I know like other cultures they eat rabbits just fine, like other cultures
Yeah.
eat like horses just fine, like they eat other stuff, and it's just us in our little American bubble to where these are just, and obviously like I say gator sausage I had in New Orleans, they eat that stuff more down south where gators
Yeah.
are. We do not have gators where we live, so that's why it's unusual and weird to me. We live in the Midwest, we don't have sharks around here, we don't have
Right.
octopus. Okay, like we can get it.
Yeah.
It's not something that's in our daily cuisine, so that's why it's
Right.
weird.
And if it is, it's gross because it's been imported from somewhere where that's normal to have those things and it's been frozen and it's just not as good
It's
when
not the
it's
same.
frozen. And then nobody knows how to cook it because it's not from here, right? Uh if it ain't meat and taters, we don't know what to do with it.
Yeah, if it's not a
Um
casserole dish, okay.
yeah. If it ain't ambrosia salad, just Google what the fuck that is. You'll be like, ugh, no thank you.
Watergate salad.
Yeah, Watergate salad.
If it's a Midwestern dish that has salad in it, it has no vegetables. Vegetables are not to be seen in a Midwestern salad. Okay, from
Right.
majority of ingredients in a Midwestern salad are not what you would normally find in a salad.
Cool
Cool
Whip,
Whip, Cool Whip,
Jello, or instant pudding mix, and some sort of canned
bananas,
fruit, mostly
yeah,
pineapples.
or bananas. They love
Yeah.
bananas.
But I think that's all we got.
That's
My
all we
other
got for
child's
you.
finna walk in the door, so my dog's gonna freak out again. And we love you. Let's hit the Julie.
Julie, do the thing!
I'm afraid there are no more things to do.
And Tenzin for good measure.
Woo!
Woo! All right, we did it. Woo! We will catch y'all next week. Unbeknownst to us, what we'll be doing at the moment, I brought up maybe PTSD, but I also have a couple other ideas swirling around in my brain, so we'll see. We'll talk to y'all later. We love you. Bye.
Okay, bye.